Hi, my name is Cameron Myers, and today I will be giving an extemporaneous speech over Apert syndrome. For my capstone topic this year in my lifespan development class, I chose Apert syndrome. I chose Apert syndrome because it is a unique intellectual disorder that no one ever hears about. It is so uncommon that it occurs in only about every 65,000 to 200,000 births, according to StatPearls. Apert syndrome is an intellectual disorder that not only affects the brain, but also the body physically. This means that the child comes out with fused bones, webbed fingers and toes, and even deformities of the face and skull. According to Children's Hospital, this deformity and intellectual disorder of Apert syndrome isn't usually known until the child comes out at birth. They can do background testing and genetical testing while in the womb, but many times, often not, it is not known until the child is born and at the time of birth. This disorder is caused by a mutation in the body. Mutations and duplications, according to our textbook, is when cells are mutated. When they are mutated, it means that the cells are changed, which are different from their original forms. And when they are duplicated, that means that there are more than what there should be. So when the mutated cells are duplicated, that means there's more bad cells than good cells within the body, which then makes the chromosomes duplicate, which then causes Apert syndrome. The cell that is being mutated and duplicated is FGFR2. This stands for fibroblast growth factor receptor 2. When a child is born with Apert syndrome, they have a 50% chance of inheriting that mutation and then passing it down onto their further generations if they decide to have children with their significant other. This means that 50% of the time an Apert syndrome patient is going to pass this down, which means that this will be replicated and replicated through generations and generations. Because a patient with Apert syndrome has fused bones, webbed fingers and toes, and undeveloped bodily structures, Children's Hospital states that they will need doctors for genetics, craniofacial, neurology, and hand and upper extremities. These surgeons are going to take place from the start of ages 6 all the way up until they are a late adult, and this is going to be a series of procedures for each bodily structure. So there will be multiple surgeries for the cranial features, the facial features, upper extremities including the arms and the fingers, and they can even go through gene therapy to reverse the FGFR2 mutation and duplication. According to StatPearls, 54% of people have one eye vision loss. This means that they can get vision surgery to correct their blindness, but even then they can still have negative factors after the surgery. Even after the surgery, they can still have one eye blindness, in which they can only see out of one eye correctly. And on the eyes that they do have surgery on, they can come out with corneal scarring, respiratory complications, and even spinal injuries. Child and Adolescent Health says that 40% of people with a disability have mental health diagnoses. This means that it could be anxiety, depression, ADHD, any of the above. It could be any mental disorder that there is in the book. This actually is a rate that is doubled than a child that does not have an intellectual disorder. Mental health becomes hard for these children with Apert syndrome, as it is found that most children that are diagnosed with Apert syndrome at the time of birth are found to live in low to middle income housing. This means that when they are in these stages of life, that means that it is hard to afford mental health help and also find help. But Apert syndrome is not only affecting the child and the patient, it is also affecting the caregivers and the people around them. Caregivers and their parents or people around them experience burnout, stress, and even strain, whether this is mental strain, physical strain, or even financial strain. The Journal of Intellectual Disability state they even experience anxiety and depression. These caregivers are not only feeding and bathing them, but they are teaching them how to live life normally and even teaching them how to walk. These children are finding it hard to develop normal abilities that we face without an intellectual disorder. They have to have extra help eating, walking, bathing. Anything that seems easy to us is 10 times harder for them. These caregivers are even experiencing financial strain. When going through the process of having Apert syndrome, they're not only spending money on trying to give the child the accessories they need and the physical help they need, but they're paying for surgeries, they're paying for doctor's appointments, they're paying for extra medical supplies that this child may need, everything. This can become a financial strain, as this means that the parents and the caregivers are not able to be home and take care of them, or they aren't able to go to work, which means that they are making less money while staying home with the child, or they are going to work and spending more money on caregivers to take care of the child or patient at home. Thank you.